Today, we're talking about something that doesn't get discussed very often in workplace mental health conversations: men. A lot of burnout conversations focus on women, which makes sense because those issues have historically affected women in specific ways. But one question that doesn't get asked very often is, what role do men play in changing workplace culture? And what support do they actually have when it comes to emotional wellness? That's what we're going to explore today. I'm joined by Asia Bowman, founder of EQ Ascent. Part of her work focuses on emotional wellness for men in professional environments and how organizations can design systems that support mental health instead of just talking about it. She also does this work by partnering with mental health providers seeking better satisfaction among male clients. Asia and I connected on LinkedIn, and her perspective immediately caught my attention because it approaches mental health from a completely different angle than what we usually hear. Asia, thank you so much for being here.
Thank you so much for having me. I'm excited to have this conversation.
Before we get into the workplace side of things, I'd love to hear your story. What led you to focus specifically on emotional wellness for men?
Thank you so much for asking that question. I actually started my career over 10 years ago, identifying community needs and designing solutions to address those needs, particularly as it related to quality of life outcomes. So working and researching underserved, underrepresented communities and finding ways to address the needs that they were facing. And in that space, I continuously noticed that boys and men were being left out of the service design conversations, as well as once the program or policy was rolled out, even engaging in that particular program or resource. And this is at a time when 80% of men make up the suicide rate. Less than 15% say that they have a close relationship. So we're talking about friendships, social circles, people that they can lean on. We're hearing a growing number of boys and men saying that they feel like people don't care about them, their perspective, what they've gone through, their realities. And at the same time, we're seeing more and more men disengage from everyday life, from work, from family, from society, from policies. And so those numbers and those realities were just very sobering for me. And it wasn't just about the statistics. When I come across statistics, I can immediately think of one or two men in my life, whether it's family, friends, social spaces, people I've worked with, men that I've just talked to that are mad, sad, frustrated, feeling displaced, feeling disconnected from themselves, not because something is inherently wrong with them or their life is terrible or they, don't know which way is up, but because they're trying to live up to a script about manhood and their masculinity and how they're supposed to perform and be presented to the world that doesn't allow for any level of emotional health at all, really, or very little, and unfortunately the emotional health programs and resources that exist, they reflect that idea that men aren't concerned about their mental and emotional health, and so they just are completely overlooked. And so I started asking the real questions. What would happen if we assumed that men were actually invested in their mental and emotional health? What are their real reasons for not engaging, and what would be the outcomes if we started approaching this with a male gender informed lens so that we can actually create specific programs and initiatives for men? So I built EQ Ascent, where we help companies do exactly that. We identify why the men that they're targeting are not engaging in their mental emotional health programs, and then we help them redesign it so that they actually do, because I'm on a personal and professional mission to redesign and reframe how we engage men in emotional health, because ultimately they need it and we need it as a society.
Looking at the companies that say they care about their employees' mental health, what do you think most workplaces are still getting wrong?
That's a great question. I think something that comes to mind, people are like, I care. I'm like, but do you care? let's like let's examine that and unpack it to really see. And I think the first thing, like, that question comes to mind, and the reason why is because there's some context that's worth naming. This push for not just men's emotional and mental health within the workplace, but for just all employees, that was not something that took place or came to be or was born in a corporate boardroom. That came from advocates, researchers, and eventually policy being pushed for corporations and workplaces to develop and implement benefit packages that included mental health and programs, right? Mm-hmm. So this is not something that's being born from corporations. Is being mandated, is being put on them. And so when you're coming from a place of, we have to do this is what's mandated, or the eyes are on us, that from the jump is going to impact the quality of the program that you're putting out, because there's a difference between doing something because you have to do it and because you're invested in doing it. So that's the first thing that I think some workplaces are still getting wrong, really being able to have that critical conversation with themselves, like, how much do we actually care about this and how much are we saying we care about this? The second thing is that most workplaces are not collecting and implementing meaningful feedback from their employees. I live strongly by nothing for us without us. And there are so many things being built and rolled out that are not considering men. They're not gathering their input either in the ideation phase, in the designing, implementation, evaluation. It's just not there really at all. That input of what it is that they're actually, the challenges that they're facing, what they actually want to see in the programs. And I think lastly, and on that point still, is if the feedback is collected, it's from a small sample group and it's the same people. It's your risers. They're on that upward trajectory. They're always quick to volunteer and be involved in something, but you're not hearing from the person, your employee that's just riding the middle. You're not hearing from that employee that's on a performance improvement plan. You're not collecting that data and that feedback from someone that started off doing really great, and within a few months or a few years, their performance has significantly declined. You're not hearing from any of them, but you're designing a program for them. How does that work?
Yeah.
And those are the ones that are disengaging from the conversation, late with the deadlines, where they have team conflict internally and externally, in the programs that you're building to help with conflict resolution, emotional regulation, communication skills, being able to identify boundaries and triggers so that you can communicate that within your workplace and get the team on the same accord. You aren't building it for those that is most needed. And so I think that data collection point, just doing it at all, who it's coming from, and examining how much we really care about this, or are we just adhering to a mandate, are some of those like starting key points that I think companies are still missing and getting wrong.
So I spent over a decade in construction management where women make up about 11% of the workforce. When my company rolled out women's groups, it often felt like we were talking about the same problems over and over, but had very little influence over changing them. And the reaction I'd sometimes get from male coworkers was, "Oh, why isn't there a men's group?" Do you think that's why men sometimes disengage from workplace wellness conversations?
You just described something like the reality perfectly, right? So you come from an industry, it's 11% female, right, or women, and 89% men. And when they decided to address mental emotional health, let's just roll out a group for women, as if 89% of our workforce is not composed of men, right? So we're already signaling that it doesn't matter. The company doesn't care about the men's mental health. And so that is one of those things of like, yes, if someone said I'm throwing a party for women and only one woman was there, I'm walking out. I'm leaving.
Yeah.
Because this is not for me. I
Yeah.
know what you said, but what you're doing is something completely different. And
Right.
I want to go back to what you were saying as far as what men are asking, like, why isn't there a men's group? Some people may hear that as like defensiveness of complaining or like mocking women, but that's a signal of interest. And when workplaces start missing it. So going back to like where workplace is going wrong, you're missing those indications and those signals that men want this too. Again, like missing it, not building from it are some of those things, some of those reasons why men disengage. And then there are some other things that they're bringing into the space, right? First is that men are told since childhood that emotional wellness is not for them. It's for women. You're weak if you're engaged in it. It just simply is not for you. You can just collect your $200 and keep going. Don't even stop, right? And so you're walking into the wellness conversation already overcome with this deep-seated belief of like, this is not even for me. It has nothing to do with me. So that's something that's coming in. And then again, I think this is something that's often overlooked, is the perception amongst men. Men pay attention to how other men perceive them, not because of ego, not because of vanity, not because they want to be like part of the cool club or anything like that. But for a lot of men, how other men perceive them and how they receive what came down to safety. It came down to social safety. It came down to physical safety for some people. Some men grew up and were not allowed to show emotions or express them. If they did, it could mean violence to them. And so when you're bringing that into the workplace, because we don't just cut off ourselves because we've now shown up to work, right? You're bringing that awareness of how you're constantly being perceived into a place in which your money is tied to, your promotions are tied to it. And if you have a family or a goal of any kind, their livelihood is attached to how you're being perceived. So that is going to stop me me, a man, from engaging in that resource if I feel like it could threaten my livelihood.
You hit on this a little bit. Historically, a lot of workplace culture was shaped around certain expectations of men. So, how do we reinforce men's emotional health without just reinforcing those same dynamics?
Love this question because it's because the answer is hire people with the expertise. Companies all the time, hire out people where there's an expert or a knowledge gap within their organization, whether it's for marketing, organizational development, PR, whatever the case may be, right? They look back and they say, we don't have that entity, we don't have the capacity. Let's bring someone in that has that knowledge to help us. That is the same mindset that needs to be applied here when it comes to mental and emotional health for men. Find you someone like myself, like EQ Ascent, like Asia Bowman, that is doing the gender male informed work in the mental health space, so we can bring in that lens, bring in those frameworks, bring in that research to show, hey, this is what men are wanting and needing. This is you recognize your knowledge gap and you bring in that expertise so that you aren't recreating that same thing. And then, so to that point, bring in the expert, but also going back to collecting the feedback. We're seeing more and more from millennials and younger that they want different representations of men, right? And you have to be paying attention to that. Recently, there a study and an article that comes to mind. UCLA recently released a study looking at millennial, Gen Z, and Gen Alpha to talk to them about the fatherhood and media representation of men. And across all generations, they wanted a different representation of fatherhood. They wanted one that was emotionally and mentally evolved and engaging in mental and emotional health, that could admit mistakes, that could be vulnerable, that could cry. They wanted something different, right? So we're hearing that come up. They're telling us we have to listen. Similarly, in the Psychology Today's website, they highlighted an article in which researchers are talking about the fatherhood flexibility stigma. And it's the idea, similar to the motherhood penalty, right, within the workplace. It's this idea that men fear professional retaliation for bringing their needs of fatherhood into the workplace, the fear of leaving work early for school pickup or needing to stay at home with the kids because they're sick. They're wondering the same thing as women do when it comes to having children. Will my pay be docked? Will I be stalled here? Will I be blacklisted? They're also facing that. And so if we want to create something that's not just reiterating the same dynamics, then we have to talk to the men that is in front of us and not the men that were there 50, 60 years ago with that knowledge. We have to do it here. And we also have to bring in those people that have that expertise to help and guide companies to be able to build something that is for men specifically.
Yeah. Okay. You just gave a lot of great tips, but if a company leader genuinely wants to improve workplace mental health for men, what's one simple place you would tell them to start?
One simple place I would tell them to start. They're all very simple. Doesn't require a large budget, but it does require intent. It requires thoughtful intent. And the first one is the simplest and the most powerful, and that is lead by example. We've heard it 1,000 times, and if you're a leader, you definitely heard it. And that doesn't mean that you're just sending out the email and encouraging people to go to it. That means you are also at that program, at that initiative, engaging that initiative, utilizing that resource. Because how you are actually operating, even if your policy says something different, your employees, your workforce is going to take their lead from you. And so show up to the sessions. Don't plan your biggest meeting of the year the same day that the mental health or the resiliency training is taking place. Reschedule it. There are 364 other days in a year. Find another time, find a different way to prioritize external meetings where it feels like you have to meet your bottom line, meet with the stakeholders in engaging in these resources alongside with your employees, because at the end of the day, your employees, that is your business, right? If they're not doing well, if they're burning out, if they are too afraid to engage in the resources because leadership is not signaling to them that it's okay to, you are going to have a burnt out workforce with a high turnover. And that's not what you want, right? A lot of companies are out here trying to get that badge or certificate of best place to work. You can't have that when people are burnt out and you aren't leading by example. And again, I have to reiterate, collect the feedback. Get that feedback from your staff, and so that you can know and understand what it is that they want and need, and also what they're utilizing and what they're not and why. every company, you know, when they have any program they roll out, they want to know what the utilization rate is. Great. So they can figure out if it's worth their, if it's a return on investment. But they're doing almost no research or very little research or investigation into why resources aren't being utilized. How are you going to improve something and you don't understand why people are not using it to begin with? So the two instructions I would give leaders is show up in the space with your employees. Don't do a separate executive leadership version over here in another room. You know, show up in that all staff meeting space or however you have it set up, and engage your workforce. Hear from them directly, and don't just hear from them collectively and say, oh, that's great, guys, we got your opinion. No, you also have to utilize it, because if you don't, you're going to erode that trust that you're trying to build with your staff, because you're saying what they say matters, but then you're not utilizing anything. So lead by example, collect the feedback.
This has been such an interesting conversation because I think a lot of the burnout discussions right now focus on individual coping strategies. But what you're talking about is really about how the systems themselves are designed and how that affects everyone in the workplace. So thank you so much for sharing your perspective today. Before we wrap up, where can people learn more about your work?
I'm on LinkedIn. It's my only social media I'm using for this work. You can find me by my name, Asia Bowman. You can also follow the business page on there, EQ Ascent. And you can visit our website at eqascent.com.
Awesome. Well, if you listening found this conversation helpful, make sure to check out Asia's work. I'll definitely include her links in the description below. And if you're interested in more conversations about workplace culture, burnout, and mental health systems, make sure to subscribe to the Soft Rebellion Club. Thanks for watching, and I'll see you in the next one.